Okay. All right. Thanks everybody for joining us today. We are really pleased to have Mike Anderson from the Interlakes Community Action Partnership, or ICAP, joining us today. But before we introduce Mike, I do want to just give us a brief overview of the collaborative, the South Dakota Healthy Nutrition Collaborative. So the purpose of the collaborative, I think everybody on here knows, but just to drive it home, it brings a collective voice to support access to nutritious food, which builds a strong foundation for healthy South Dakota families and communities to prosper. Our goal groups, we have three of them. One is to improve coordination, identify areas of statewide research and evaluation, and promote programmatic best practices to improve South Dakotans' food and nutrition security. The second is to elevate the voices of food and nutrition advocates, researchers, and individuals experiencing food and nutrition insecurity. And the third is to advance policy implementation to improve food and nutrition security in South Dakota. So with that, I am really happy to introduce Mike Anderson, again from ICAP. He's kicking off our Summer Lunch and Learn series, and Mike is the Chief Operating and Advancement Officer at ICAP, and he is located in Madison, South Dakota. So, Mike, I'm going to go ahead and shift it over to you.
Thank you, Jennifer. Yeah, as Jennifer said, my name is Mike Anderson. I work out of Madison at Interlakes Community Action Partnership. Um, we're a community action agency located in eastern South Dakota. We cover 14 counties in central eastern South Dakota and 5 counties in western South Dakota. We have a large, about 40 different programs that we serve and work with here in this area. I'm going to share my screen here with you as we go through. There we go. Do we have that?
It's still coming through. Yep, there it is. Thanks, Mike.
Oh, perfect, perfect. So basically, I'd like to tell a little bit about our senior nutrition program, even though ICAP has many programs here, and specifically our frozen meal packs that we developed a number of years ago. The frozen meal packs started in an emergency and it turned into a collaboration serving complete nutritious meals across the state of South Dakota. Basically, we went from, COVID, when the pandemic hit, that COVID emergency, to a statewide mission. And I want to share with you today how that happened and why ICAP is part of this collaborative. First, a little bit about Interlakes Community Action. I mentioned a little bit here earlier, but Interlakes, or ICAP, is a community action agency. We were established in 1966, and today we serve 14 counties in east central South Dakota and 5 counties across western South Dakota. We help people meet immediate needs, and building long-term stability with innovative people-first approach to meeting basic needs and strengthening every community that we serve. ICAP, it has a wide range of services from community supportive programs, Head Start and Early Head Start, nutrition and health, including 60s plus dining. We have housing programs from self-help housing, where they actually build homes, to self-help rehab, weatherization, rental assistance. We have income stability programs like VITA, free tax preparation, and energy assistance. In total, ICAP manages around 40 different programs, and the Senior Nutrition Program is one of our larger programs. Our frozen meal program during COVID, it was not something that we dreamed up or planned during some planning retreat. It started in March of 2020 when COVID hit. And at that time, we had 49 congregate meal sites across our 10 counties that we served here in eastern South Dakota. Those 10 counties covered around 7,000 square miles. And at the time, we were operating with about 7 site managers. We also had 3 kitchens across eastern South Dakota, one in Watertown, one in Brookings, and one in Madison. One of the things that we didn't have is we had a disaster plan, but our disaster plans, they did not have anything written for a pandemic like this. We had plans where if one community was affected with floods or tornadoes. If some sort of crisis happened in one of those towns, what would we do? Where would we bring the meals from? What we didn't have was a disaster plan that uh, told us how we were going to take care of if all 49 of our congregate meal sites, all of our home delivered sites, and all of our nursing home collaborations and hospitals that closed, if all of those closed at the same time. So what we built, and it was basically overnight, was a frozen meal pack program. It was a 7 meal, 1 week pack with 10 entree choices. We come up with the idea that individuals could choose their own meal plans that they wanted. We knew that if we just sent a random set of meals, there's always going to be something they don't like, and what's going to happen with that is they're not going to eat it. And they're either going to throw it away or whatever. They're not going to get the nutrition, and it kind of defeats the purpose. So we really focused on South Dakota Midwestern recipes, things like roast beef dinners, turkey dinners. We had sweet and sour meatballs, lemon peppered cod, pork, and many more. Folks, then they pick their 7 items. Sometimes we had people pick 7 of the same items, but they'd pick 7 items. We'd deliver them right to their door. They'd get a half-gallon of milk, loaf of bread, and a carton of juice. And the nutrition program, I don't know if you know this, but operates on a free will donation. And that matters because we didn't want any senior, not a single senior sitting at home doing the math on whether they could afford to eat or not. The message we gave them was simple: give whatever you can, and we'll make sure that you are taken care of. Early on, when we started this up, we were lucky enough to get some support from the Meals on Wheels America program. We couldn't have stood up that fast without their help. They stepped in with a $25,000 grant from their COVID-19 response fund, and that year we delivered close to 71,000 meals to about 3,900 clients. So pretty big response at a time when we weren't even doing the frozen meal program. We went to our staff. It was kind of a scary time because everyone's being told to stay home, including workers. And my workers said, the staff said to me, Mike, these people are who we see every day, and we have to do something. So we went to work, put in a lot of long hours, cooking, baking, packing, and then the next obstacle became how to get them to people across our counties. Turns out we had an answer for that. Our own Head Start teachers, whose classrooms had just closed, were calling, asking how they could help. And just like that, we had an army of volunteers. Why frozen meals fit in South Dakota? I put this slide together just to talk about, something that I think we've talked about on this collaboration as well, the long distances that people have to drive every day just to get access to food, or even delivering food. The winter weather is something that, blizzard comes in and people are shut in for a day or two, or people are unable to, again, get to even their local grocery stores or convenience stores. Food deserts. We know a lot of these small towns, and I became more aware of that during this pandemic, how many of these towns had absolutely no food service, no gas station, no convenience store, no Dollar General, no grocery store. And the closest grocery store, or the closest place that they could get any food, was 30 to 40 miles away. We also lost local sites. For the senior nutrition program, we operated with a lot of collaboration with a lot of restaurants, a lot of nursing homes, hospitals. A lot of the restaurants closed, and they're still closing today. A lot of the hospitals and nursing homes, they basically went on shutdown, did not want to have to deal with a lot of people coming in and out at the time of the pandemic. And to be honest, that's still mostly the same today. We do still have some collaborations with some nursing homes out there that do a great job for us. Fixed incomes. We know that people are on fixed incomes. The free will donation helps with that. We have seniors, and we found that out. We have a lot of seniors who really have nothing. And then there's isolation. delivery, whether it's a daily delivery from Meals on Wheels or whether it's a once a week delivery with packs like this, any delivery is also a check-in, right? It's a way for us to check in. It's sometimes the only face-to-face that seniors see all day or maybe all week. Frozen meals, they're not the only answer. Where we have our local kitchens or partners still exist, we do want to serve the hot meals and daily service. We want that daily interaction. In most communities, the right answer is probably both, serving both the daily hot meals and frozen meals. But in some areas, the frozen meals are the only option. Recently, about a year or last fall in October, we took on a new initiative. We had a number of people that came to us and informed us that several communities in western South Dakota were losing their home delivered meal service. The state contacted us and at one time said they had nobody that was really stepping in to help them. And we were a long ways away. There were a lot of other nutrition programs out there or even close by there, but the long distances, the low donations, the financial part of it didn't make sense for a lot of them to be expanding at that time. The state contacted us and asked if we would or could help. And the short answer, we just said yes. And we said we'd figure it out, which actually was kind of scary. So we took on the 5 counties in western South Dakota: Meade, Fall River, Bennett, Dewey, and Perkins. That included communities like Sturgis, Hot Springs, Edgemont, Lemon, Martin. We were in uh, up at Isabel, Faith, kind of all over the board. So when we were given the information that we first received the contract from the state to cover or for a partial coverage of our meals in western South Dakota, we had basically 2 weeks before that time started. 2 weeks is not enough time to build a polished operation, so we built a working one. The first runs that we went out to these counties and these communities were about as hands-on as it gets. We cooked and baked, like I said, all night, packed. We bought a used trailer. We bought a number of freezers. We loaded up a generator and we hooked it to a pickup and we went. On the first run, we hauled over 1,000 meals out to these communities, and the people doing the hauling and handing out door to door were our CEO, our program director, and me. On the second run, we bought a freezer truck and brought that into the picture. That made things a little easier. We could actually split then because we had stops in places like Timberlake and Isabel going way up north, and then we had stops in Martin going way down south, and we were going as far north and south as you could once we got to Lemon, South Dakota, up north western, and Edgemont down in the southwestern part of the state. So having 2 vehicles made things a lot easier. Um, and I don't tell this story because everything went smooth, but it wasn't smooth. It was not easy. But it is exactly what community action is supposed to do. When people are about to fall through a gap, you just find a way. Now, we didn't do it alone. In fact, we knew we couldn't do it alone. This takes collaboration. It's one of the things why I'm really interested in this South Dakota Healthy Nutrition Coalition is the fact that we need collaboration, we need innovation, and we need people to work together, right? The 2 partners in particular that made this sustainable is Feeding South Dakota. They carried out the logistics and distribution across those long western routes, and they have been a true partner in every sense. And Western South Dakota Community Action has given us local presence, credibility, and coordination on the ground. In a part of the state where the relationships are everything. Without them, this really didn't work, or wouldn't work, I should say. We also knew, and like we mentioned before, our menus were really important. As you can see, this is actually what's on our menu right now. We have roast beef, mushroom Swiss chicken, pulled pork, uh, a number of different items. Alfredo meatballs, chicken marinara pasta. Uh, um, so our clients kind of determine the menus and where we're going with that. So where does this leave us today? Our nutrition program now serves more than 200,000 senior meals a year, and close to 100,000 of those are frozen. Uh, we went from a 7 meal emergency pack delivery to a few hundred isolated seniors to a statewide program in over a few years. Um, this chart really kind of tells the whole story. The frozen model we built out of a panic is now a very large part of what we do. Currently, the last piece that we need to kind of really bring this program together is a large commercial kitchen. And this is where a collaboration of a number of different partners came together in a project that we call Summit on Van Epps. This last piece is the future and our answer to our infrastructure. This Summit on Van Epps is a new low-income or income-based tax credit property for affordable housing and with mixed use, a commercial kitchen. This pairs the housing with commercial kitchen and a senior dining space. The kitchen is the engine for the next chapter, and it strengthens our 60s plus dining program and statewide frozen backbone. And it also gives us room to scale up in any emergency. It does something that I'm pretty proud of, and that's that the kitchen will prepare meals for Head Start children next door, and it will also serve meals for seniors, both in the community and outside in the state as well. We will, and just we'll be having a groundbreaking here July 22nd, so that's coming up really soon. So I'll leave this with you, and this is something that's important to me as well. Where someone lives should not decide whether they eat well. It shouldn't decide their access to food. And that's why we are, ICAP is part of the South Dakota Healthy Nutrition Collaborative. And the work that all of you do and the work that we're doing here is bigger than any one of us. And our seniors are counting on us together to get it done.
Wow, Mike, that was inspiring. Honestly, I have so many questions. I'm going to go ahead and stop the recording and then we can start our discussion.
Yeah.